Till 8 p.m. last night, there were 1,480 locally acquired cases of COVID-19 in New South Wales, and there were 0 overseas acquired cases. We had 130,341 tests reported till 8 p.m. last night. So again, very good testing numbers, and thank you to everybody coming forward promptly for testing if you have even the mildest of symptoms. Currently, there are about 11,000 people with COVID-19 who are being cared for by New South Wales Health, and the vast majority of those, over 90%, are being cared for in the community or in New South Wales Health's special health accommodation. There are currently 1,136 people with COVID-19 admitted to hospital. 194 people are in intensive care, and 78 of those are currently requiring ventilation. Of the 194 people in ICU, 158 are not vaccinated. Sadly, today we are reporting the deaths of 9 people with COVID-19. They are a man in his 60s from Dubbo who died in Prince Alfred Hospital. He is not vaccinated. He was not vaccinated and had some significant underlying health conditions. We also report the death of a man in his 90s from southeastern Sydney who died at St George Hospital. He was a resident of the St George Aged Care Facility in Bexley, where he acquired his infection, and his death is the 3rd death linked to this aged care facility. We're also reporting the tragic death of a man in his 20s from Western Sydney who died in Nepean Hospital. He was not vaccinated and also had serious underlying health conditions. We are also reporting the death of a man in his 80s from southeastern Sydney who died at Prince of Wales, a woman in her 60s from western Sydney, Agnes Banks, who died at Nepean Hospital, a man in his 70s from Western Sydney who died at St Vincent's Hospital, a man in his 80s from Western Sydney who died at Westmead Hospital, a man in his 70s from southwestern Sydney who died at Liverpool, and a man in his 40s from southwestern Sydney who also died at Liverpool Hospital. 7 of the 9 cases of people who died that we're reporting today were not vaccinated. 1 person had had 1 dose and 1 person had had 2 doses, and all those individuals had underlying health conditions. On behalf of New South Wales Health, I do extend my deepest sympathies to the families of those individuals who have lost their lives. Today, I'd like to draw attention to a few areas for people to come forward for vaccination and for testing and to be aware, particularly of symptoms. We've had a sewage detection in the Bonny Hills area of the mid-north coast. We're currently unaware of any cases in the Bonny Hills area, so if you do live locally, please be aware for symptoms and please come forward for testing. In terms of our suburbs of concern, we remain concerned about suburbs that we've previously mentioned in the Western Sydney and Southwestern Sydney area, and we encourage residents of those areas to come forward for vaccination as soon as you can. We're also concerned about case numbers in the areas of Glebe, Waterloo, Redfern and Marrickville, and I'd like to encourage the residents of those suburbs as well to please come forward for vaccination. The Sydney Local Health District has set up some special clinics, Pfizer clinics, where bookings can be made or walk-in appointments can be made for residents of those areas. And they are clinics at the Peter Forsyth Auditorium in Glebe, the PCYC in Marrickville, and the West Leagues Club in Ashfield. So please, if you live in those suburbs, come forward to get vaccinated. Please look out for symptoms and get tested if you have even the mildest of symptoms. I'd also like to thank all residents of those 12 LGAs of concern in particular for coming forward. We're really seeing great vaccination numbers from people in those areas, which is fantastic. And I'd particularly like to ask people who live in suburbs around the Liverpool area and the suburbs around the Parramatta area as well to come forward for vaccination. So thank you very much.